is next. That is actually, sorry nga, natabunan man. That is histogram, no? Histogram. H-I-S na siya. Histo. Sorry, na kuan sa akong camera din na ko ma-change. Okay, histogram. So histogram is a graphic representation of a data set. So data set would refer to the pixels na to, no? So again, excuse me. The pixels sa atong monitor, they would represent the different signals nga nakuha sa ato ang PSP. So more signal, that means black. A lot of signal, that means black. If there is no signal, then it would appear white. If there is an average amount, then maybe it would appear as gray. So in between the white and then the black, we have the gray. Okay. So a histogram, again, is a graphic representation of a data set, which includes the pixels that represent the image before edge detection and rescaling. Okay, so let's later ato na siyang ma-describe. Okay, so again, pixels. No, pixels represents the signal that was received by each of the by the phosphor layer nato sa atong PSP, and then also was converted into a digital image and then represented by each of the pixel. So if more signal was received, if a lot of signals received, it would appear as black. Like for example, again, as mentioned earlier, lungs appear black because it is a very low dense structure, a lot of X-ray, but the lungs contains air, so that means it is a very low density structure. So more X-rays will be allowed to pass through. It would appear as black. Okay, and then if the structure absorbs a lot of X-ray, that means little X-ray is allowed to interact with the phosphor layer, with the imaging plate, and that means it would appear as white. Okay, so for example, in the center, no, white kayo iyang color because there is little X-rays or almost no X-ray have reached the imaging receptor or the image receptor. Okay, so the histogram is basically kani. This is the histogram, basically a data representation. It's a graphic representation of the data set or the pixels. Like for example, how many of the pixels in the matrix has this density? Okay, so how many of the pixels has this density? How many of the pixels has this density? So that's basically the histogram, the number of or the graphic representation of each pixel if ato siyang individual. Like for example, we would try to count the individual pixels, how many of them are black, how many of them are white, how many of them are gray, how many of them are dark gray, how many of them are light gray, and then we would try to count all of them. So like for example, there are 500 of this black na pixel, and there are 600 of this white pixel, there is 300 of this gray pixel. Okay, so that's basically the data representation that's presented on a histogram. Like for example, you have two images, an image that is very dark and then an image that has, like for example, this one, an equalized histogram. So that means the density and then the contrast has already been adjusted. Okay, so as you can see in this image, the lungs are very dark, so that's why the pixels or the histogram represents most of the pixel has been concentrated on this area, which is very dark. While on the second image, the concentration is on the lighter portion. That's mga grayish nga portion towards the white nga portion, but then on the mid-gray po sad nga area. Okay, so in which we can see in the image that there is no very dark portions. No, there is no very dark portion, so that's why the very dark nga graph has lessened compared to this part. Okay, so that is basically a histogram. Okay, so another example, very basic example of a histogram. Like for example, this one, range of exposure to the receptor, that is our histogram. So like for example, this part of the histogram is this area of the radiograph. This area of the histogram represents this part of the radiograph, and then this part of the histogram represents this part of the radiograph. Now, basically, they are represented as colors. Okay, gibali lang sila compared to sa histogram ganina, kaya ang dark na portion is naa-diri dapit, diba? And then the light portion sa previous histogram is naa-diri. Napit yung dark diri, light, but in this histogram, the light is on this side and then the dark is on this side. That's siya. Okay, so again, that's basically the pixels, no? The colors of the pixels. How many of them have this color? How many of them have this color? How many of them are this color? And when it comes to the computer system, no, we can actually measure. We can quantitate. We can have a definite na quantity for this type of pixel. Like for example, kani siya nga pixel, ang iyahang histogram o yung pixel value, let's try to say the pixel value is 100. This pixel is 500 yung value. This pixel is 350 yung value. Another pixel would represent 1,000 yung value. So those numbers would be represented on the histogram as kani graph, no, as a line, kibali. Then what is the representation, and then the amount, then how much of them have this. So for example, 1,600 of them contain this one. Approximately 200 pixels have this type of color or this type of shade. Okay, so that's basically the histogram. Okay, so next we have the exposure field recognition. So, musulod po dayon diritong next nato nga kon. Katong next nga trigger, which is katong error. So, one of the errors there was exposure field recognition error. Okay? So, exposure field recognition, when it comes to computed and digital radiography, is very important. Okay? So, exposure field recognition identifies the collimated borders of the exposed field and eliminate signal from the outside area. Okay, so the computed radiography nato nga scanner, okay, is very sensitive. No? It's very sensitive to the collimated nga part. Like for example, in these images nato, the whole of this part, the whole ni siya dere, that is the size of the IR. Kani siya, mo siya ang size sa IR. And then the red one, red gihapon akong pen. Try to, so man siya. How about the highlighter? Ana na lang. Okay, so this is the size of the cassette. Ano siya? The whole. That is the size of the cassette. Ano siya? And then the red portion is the collimated nga part. Of course, diba? We need to practice correct collimation. We need to collimate only towards the area of interest. Okay, so you have a very large cassette, and then you have only a very little. You have a very little area of interest. For example, the area of interest is only the fingers, the hand, or the knee. But they are very small structures. Okay, so the processor will scan, will scan all of the imaging plate, the whole of the imaging plate. But then it is very sensitive to the part that is collimated. Now the part that has the highest signal kibali. So the computer system, okay, the algorithms kibali sa atong computer systems, when it comes to CR and DR, should be able to recognize the borders. Okay, they should be able to recognize all the borders that are present. So that means the four-sided collimation should be, or the computer system should be able to recognize all of the borders, all of the four borders sa ato ang collimation. Okay, so like, and if the computer or the processor or the algorithm in the computer system is malfunctioning, then that's the time that we have the exposure field recognition error. So that means wala niya gi-recognize ang borders kibali sa collimation nimo nga gibuhat. Like for example, in this image and this letter D. Okay? So this is the whole of the image, and then this is the border nga gi-recognize. Instead nga this part only, let's try to highlight. So instead that the collimated border is up to this point only na siya. So there is an error na wala niya gi-recognize. So there is an extended part dere na siya nga gi-display kibali sa computer towards the monitor. Okay? So when it comes to processing of the image, we'll try to understand more exposure field recognition. When it comes to processing of the image, wala inyo nakita. Exact size of the cassette scanned, that is exact size of the cassette scanned by the processor. Kanisa, again, diba? The whole size of the cassette will be scanned by the processor. So, tanan sa imuhang cassette, tanan sa imuhang IP plate will be scanned by the processor. Kana siya. Okay? And then, when it comes to displaying of the image, okay, when it comes to displaying of the image towards the monitor, it's not actually the whole nga iyang i-display, but rather only the collimated portion. Like for example, kani, image displayed on the monitor. Even if you have a very large image receptor, if you collimated to the area of interest, the computer should be able to recognize that this is your collimated area and this is what should be displayed on the monitor. Okay, so muna siya, field recognition, exposure field nga recognition. That means this is the exposed field, so this is the only part of the image that will be displayed on the monitor. Okay, so dapat walay excess. Like for example, on this image, no, there is an excess image that is displayed on the monitor. So that means na-error na nag-error siya. That means wala niya na-recognize. So if this would happen very frequently, like for example, in your you have 5 exposures and then it happened to 4 out of 5 or 3 out of 5. So that means you have to contact the engineer of your the equipment or your machine in order for you to troubleshoot. Okay, so that means there is a problem. Okay, so that means it can be easily corrected. No? It can be, like for example, and one of the advantage good when it comes to computer and digital radiography, even if the computer system or the monitor will display all of this image, since you are dealing with a computerized image, we can actually have it cropped. No, pwede nato na siya i-crop. Similar sa gapang buhaton niyo sa inyong mga pictures, no? When it comes to your mga selfie ninyo, mga groupie ninyo, diba? You can crop the images. You can have it. You can have a wide picture, but then you can crop it so that the picture will become smaller. So parts of the picture will not be displayed. So that is actually integrated in the computed radiography and digital radiography nga mga systems. No, we can crop the images. So, like for example, this is the whole of the image, and then my target is only the clavicle. So I can display the clavicle on the monitor as clavicle itself, even if the exposed part of the patient is the whole of the chest. No, but then only the clavicle will be displayed on the monitor. So I can do that. Okay, so that I can do that in digital and also in computed radiography ng mga systems. Okay, like for example, in this image, if I only want to display this part, then I can do that. No, or maybe I want to display only this part, so I will erase this one. I will crop out this area, so I can also do that one. Okay, so basically, cropping of the images is allowed, no, when it comes to computed and digital radiography. But of course, no, one of the malpractice manggod na siya when it comes to computed and digital radiography. One of the malpractice is the non-practice of collimation. Okay, too much collimation is applied. Like for example, the target is the chest of the patient, mag-chest PA, and then the collimation is up to the head of the patient. So that means you are collimating too much. No? That means you are exposing parts of the patient that are necessary to the examination. Okay. So even if we are allowed to crop, no, we are allowed to crop the images, but still practice always the radiation protection na ang mga measurements, especially collimation. Okay, so collimate only to the area of interest. So ayaw palabi. Ayaw pudpud sobra ka gamay kay of course that would result a to unacceptable nga radiograph. So not acceptable, unacceptable nga radiograph. So that means you need to repeat the examination. Okay. So another, we have also part of the exposure recognition error. Okay, so in automatic processing, like for example, you have, this is digital radiography. You have double exposure, or you took two exposures in one imaging plate. Okay, so it will display that. Like for example, after automatic processing, this will be the image that will be displayed, the whole. This will be the whole image that will be displayed on your monitor. But then right after processing of the computer, then it will display it as this. Okay, and then right after the computer will display these images, then that's the time that you can do a manual processing. No, maybe the after automatic processing, the image appears very dark or very light. So right after manual processing, so we can adjust the contrast and the density to an adequate contrast and also density that is required for the examination. Okay, so one of the advantage other than cropping of the images, we can also adjust the contrast and density of the images. Now, similar to your pictures, that you can adjust the contrast and then the brightness, diba? The contrast and brightness of the radiographic images in CR and DR can also be adjusted. Like for example, you use too much factor. Like for example, in the next trigger na to. Okay, so the next trigger, the problem adto was sayop ang factor, no, wrong factor ang nagamit. Instead nga factor for chest, nagamit nga factor is for the abdomen. So that means that would result to a very dark radiograph. Okay, comparing the factors when it comes to abdomen and chest, abdomen requires an increase in the technique factors. Okay, so if we would use the technique factors to abdomen, we would expose the chest, so that would result a very dark radiograph. Okay, so if that would be the result, if we have a very dark radiograph, the computer system would not actually display the radiograph as very dark. Now, it would actually display the radiograph as if you have an optimal na contrast, as if you have the adequate contrast and density required for the examination. Bahala pag even if your factor is too much, your factor is too less, the computer system can automatically adjust. Now, that is the automatic scaling system, automatically adjust to the required contrast and density based on the examination that you have selected. So next, we have the automatic rescaling system, or automatic rescaling. This means that images are produced regardless of the amount of exposure with uniform contrast and density. Okay, so that is as previously mentioned, even if you have a very high exposure technique factor, that means your film is overexposed or your film is underexposed, you would still produce the optimum amount of contrast and density on your radiograph because it is automatically adjusted. So that is done through automatic rescaling. Okay, so images are produced that have uniform brightness and constant contrast regardless of the amount of exposure. Okay, like for example, in these different types of images, You have the optimum exposure, that is the required exposure for the examination. You have a low exposure na technique, and then last you have a high exposure na technique. Okay, so even if you have a very low exposure technique or you have a very high exposure technique, both low and high exposure technique, the images that will be displayed on your monitor will actually be almost the same with the optimum exposure nga technique factor. No? The monitor will not, or the computer system will not display the images on your monitor as very dark or very light images, but rather the images will have an optimum contrast, optimum density, and then optimum contrast on the image. Okay, so this is because of the wide latitude. This is because of the wide latitude of the digital imaging system. Okay, so balik dito sa rad technique ng mga discussions about latitude. Latitude is the range of exposure to which the X-ray film is sensitive. Diba? When it comes to screen film, we have a very narrow latitude compared to the digital. No? The digital system has a very wide latitude. In screen film, we have a wide latitude, but compared the wide latitude to the wide latitude sa ato ang digital imaging system, the digital imaging system has a much wider latitude. Okay. So, so how is this automatic scaling being integrated into the system, to the computer system? So this is an example, a screenshot, dili na siya video, but rather a screenshot of the video on how the automatic scaling system can be integrated, even though if wala gid siya nakita dere, but this is how the general idea. Okay, like for example, the examination required is for the upper extremity. Like for example, in this one, if the examination or the imaging plate contains the image for an upper extremity na examination, so you should click an upper extremity na content, like for example, dere. Okay, before pressing the scan, this one, before pressing the scan, you need to press which type or what type of examination did you do to the patient. Okay, so once you're done in picking the type of examination, then that's the time you insert the cassette right after the procedure, and then you start the scan. Okay, and then when the scanning will start, no, again, it will scan the whole of the imaging plate and then display on the monitor only the part that is being collimated, the part of the image receptor that has been collimated. And then how would it adjust to the different contrast and density? So it would adjust the different brightness and contrast on the image based on the examination that you have picked. Okay, so that means since diba, it is integrated in the computer naman good, no? So that means that the engineers, no, as they install this one, and also the manufacturers of the machine, that means they have already incorporated in the system what are the adequate amount of contrast and density for a skull examination, for an upper extremity examination, for a chest examination, for an abdomen examination, for a spine examination. So ilan lang na-set daan. Like for example, upper extremity. So dapat butang na to ang giset nila is high contrast. No? That means better in spatial resolution. And then if ever better ang contrast resolution compared to spatial resolution, so that means for example, the abdomen. So dapat mas better ang contrast kaysa sa spatial resolution. So iyang i-adjust dayon na siya diretso. Okay, so that is automatic rescaling. So as you can see, this is just an example of how a computed radiography system, the monitor nila would look like. So they have an image here that was processed. They can adjust the brightness and contrast. They can flip the images. They can put annotations. They can invert the color of the images. They can reset the image back to its when you try to reset the image, that means the whole, no, the whole of the image receptor, uh, like for example, balik to image. If they would try to reset, no, if we would press the reset button, then the whole, this one, will be displayed in the monitor. Okay, so that is the reset button. That is what the reset button is for. Okay, so na siya, you have the scanning button, and then in the middle of the scanning, if you want to stop, then you can stop. You can stop, and then you can also eject. There are buttons in the monitor in which we can eject safely the the imaging plate or the cassette for the imaging plate. Okay, so we also have an exposure indicator. No? So how is it that the automatic scaling system is able to convert the different values of pixel into another type? So that is actually part of the exposure indicator. Okay, so the exposure indicator, similar to a histogram. Again, no, the histogram is the the values of the pixel being represented in a graph. You know, how much of the pixel has this color, and then if this is the color, how much of the pixels that is in all of the matrix has also this type of color. So exposure indicator is numerical parameter used in computer radiography to inform operators about the amount of exposure to the imaging plate. Okay. Okay, so like for example, the exposure index to a different to a specific pixel. Okay, so how much does this pixel represent? No? If the pixel would represent a black na color, so how much exposure did it receive? If the pixel would represent a light gray na color, so how much exposure did it receive? So that is basically the exposure indicator. So they can have that, like for example, sa previous image, wala lang siya na display o gaya no, maybe na wala nila gi-display there. But there are settings in which we can actually see the exposure indicator, like how much exposure did the imaging plate receive. Okay, so na mga values dere dili kay sila maklaro, no. I guess this is this one. I'm not sure if that is the correct value. Okay, so different manufacturers, different companies would, of course, their platforms are different. Okay, so that means maybe the exposure indicator can be displayed on this side. Maybe the exposure indicator will be displayed on this portion, or maybe in this portion. So depende kung asa nila ma-set up, no. But in this image, I guess there is no indicator of the exposure indicator. This is the name of the patient. This could be so this is the name of the patient. This could be the ID marker of the patient. I don't know what this is. Okay. And then most commonly, the indicator magod is na repeat nga portion. Now, how much exposure was received by the imaging plate. Usually indicated on this portion, either this or na other repeats bottom part. Okay. So next we have same line is ano, kept sa what do you call this? The exposure, the automatic scaling system. Okay, so what is the effect of exposure on image quality? Okay, so because of automatic scaling, sometimes we do not see the original image right after processing, even if the image is too bright. Like for example, in this one, the image was too bright. That means underexposed ang ato ang film. And then on this image, the image is too dark, the original image niya, but then the displayed image is of optimum contrast and density. So even if the image that you have taken from the patient was too bright or too dark, again, the computer will automatically rescale, automatically adjust the contrast and density based on the exposure that you have set on the monitor or on the computed radiography system. Like for example, in the problem na triggered, chest examination, abdominal examination ang factor nga nagamit. So the factor was too high. Okay? So there can be no problem no, if the rad tech pick the chest exam. Ano, this one. So like for example, in the setting up of the examination in the computer, si rad tech, iyang gi-press is kani na siya before he inserted the cassette. So chest ang napili ni Radtech, and then during the exposure, the factor was too high, no overexposed si patient, overexposed ang film. Okay, so there's no problem with that. Okay, the problem is overexposed si patient, but then when it comes to image processing, no, there is no problem with that. Okay, the si Radtech pick the chest examine. Okay, and then once the computer receives the image, since the examination required is just, even if the factor was too high, even if the exposure was too high, it will display the optimum amount of contrast and density on the monitor. Okay, so that means bahala pag hayag kayo mo nakuha, ngit-ngit kayo mo nakuha nga radiograph, as long as you have the automatic scaling system, so it will display it as this. Okay, so almost equal to this. Okay, so of course, if you have very little signal, if you receive very little signal, if you use very low exposure technique, then if the system will automatically rescale the image, it will result to high noise. That means noisy ang atong image. If we would try to compare that sa atong mga television, no, try to imagine nga walay signal, no, walay signal sa inyo ha mga antenna, walay signal sa inyo ha mga TV. So it would result to a very noisy nga TV, no, katong daghan kay lamok ang inyohan TV. So kanang mga lamok-lamok sa atong television, that is also true to the computed radiography and digital radiography nga images. Once there is very little signal, then we would see a lot of noise. We would see a lot of lamok-lamok sa ato ang digital image. Okay? So if we have a lot of signal, then better. No? If we have a lot of signal, then the better, because we have a lot of signal to deal with. We have a lot of signal that we can use in order for us to display the images. Okay? So again, it would relate back to the fact that the computed radiography and digital radiography system have a very wide latitude. Again, the latitude would refer to the sensitivity of the system. Okay? So how much of the factor or how much of the data that was received from the X-rays can be used to produce an acceptable image. So like for example, screen film. Screen film, very narrow atong latitude. So that means very high ang possibility nga masayop ta sa ato ang factor. Like for example, if the factor would go beyond this portion, that means that would result to overexposure. If your factor goes below this portion, then that would result to underexposure of your film. Okay, so of course, the films that we are producing, we are still using when it comes to screen film, we are using the X-ray film. So right after processing with a chemical, the images that we can see are hard copy. No, we cannot adjust the brightness, we cannot adjust the contrast, we cannot adjust the density. So what you see is what you get. But that means we cannot adjust unless, of course, we re-expose the patient. No, we repeat the examination in order for us to get the adequate amount contrast and density. Okay, so again, balik ta sa akong na first mention sa aning discussion. one of the main advantage in CR is the reduction of repeat examination caused by miscalculation in the technique factors, no, or incorrect and technique factors because of its very wide latitude. Okay, so that means even if we have a, again, balik-balik, no, even if we have a very low exposure, or we incorrectly use a very low exposure technique or very high ang atong exposure nga technique, it would still result to an adequate, it would still result to uh, the rod tech producing an adequate amount of contrast and density on the radiograph that could still be acceptable to the radiologist. So that means the radiologist would not recommend a repeat examination because the contrast and density can also be adjusted. Yeah? So that means very advantage to the patient. But then of course, kita as rad tech, we also have to know, we also have to practice the correct collimation and then correct technique factors. So please do not use exposures that are too much or maybe exposures that are too less, because that would also result to a very noisy image or unacceptable po sa nga image. Okay, so there are several digital processing methods that can be used to adjust the contrast characteristic of an image. So we have here the lookup table. The lookup table is actually integrated po sa dito sa automatic scaling system. No? Lookup tables are data stored in the computer that is used to substitute new values for each pixel during processing. So what does this mean? So again, mabalik tayo sa automatic rescaling system. They are related naman po. So automatic rescaling system, your image is very dark. Okay, your image is very dark, but then the processor or the computer automatically adjusts the very dark image into an acceptable gray image. Okay, so that is the lookup table. That is the function of the lookup table. So how is it that the automatic rescaling system is able to adjust? No? So kato siya, si automatic scaling system actually depends on the lookup table. Okay, like for example, on this portion, this is the original image. The original image is quite too dark for it to be read by the radiologist, and it is not diagnostically acceptable. So after processing, after automatic scaling, the use of the lookup table, or also another type is windowing, that is siya, the processed image appears optimal. No, appears optimal. So that means the contrast and density are already acceptable for the radiologist to provide an adequate and then diagnostically acceptable diagnosis for the patient. Okay, so when you try to look at the next image, digital image processing to change contrast. So contrast is changed by changing pixel value. So again, when it comes to digital computed radiography, the images that we can see on the monitor, if we can zoom in on those individual na mga elements, we can see that they are composed of individual squares, so individual boxes, and those individual boxes are called pixels. And then these pixels contain different values, and then these values are a representation of the intensity that they received from the PSP, and in turn, pod sad, the PSP, dito pod sad gikan ang iyahang signal that he released from the signal that was received from the X-ray beam. Okay, so the more X-rays that you give to the patient, the more signal that will be received, the more X-rays that will be received by the PSP, the more light that the PSP will release, the more light signal that will be collected by the collecting element, and then the collecting element, the more light po sad niya makollect, and the more electrons will be converted, the more electrons will be converted into a digital signal. So that means more po sad ang value sa ato ang pixel. Okay, so lookup table, so for example in this one, so again, these are already incorporated naman good when it comes to the computed radiography ng mga systems and also sa digital nga mga system. So dili naga-adjust si RadTech ani when it comes to the clinical setting. So this is already incorporated. Okay. So like for example, you have a 40. The value of the pixel is 40 and then the value of the pixel is 30. So if, like for example, this is a chest examination, and if you have a value of 40, like for example, similar to a, maybe familiar mo sa coding sa computer, na similar to coding a computer, you can put commands, no? You can put commands on the computer system in which if the value is equal to this, then adjust it automatically to this value. Like for example, if the pixel value is at 40, then adjust it to 90. If the pixel value is at 30, then adjust it to 10. Okay, so that is basically what the lookup table and then the automatic scaling is doing. No? It's trying to pick up the original values and then trying to process the image based on the values that was set already by the manufacturer or by the engineers based on the examination that was required. So again, we have here substitute the new values for each pixel during processing. If you have a pixel that is very dark pero dili siya needed for that type of examination, then it will try to substitute that pixel value into another value. So that means all of the pixel values will also be adjusted. Okay, so if we would try to look at the histogram, for example, these values of pixels should be adjusted so that they would appear as if the values of the pixel are in this portion. So like for example, atong ibaligan nina. Instead of representing the pixel as a 90 dito sa ato ang monitor, which is very dark, so the 90 would be represented as 40. Okay, so that means the gray levels will be equalized. Instead of having a very dark image, again, balik sa itong histogram, instead of having a very dark image, your image now becomes more grayish, no? Becomes more equalized ang pagka-gray. There is no very dark nga mga portion, and then there is no very light po sa nga mga portion. Okay, so almost equalize sila on the grayish nga mga levels, which would of course represent the true anatomy of the organ. Okay, so this was the second or the last trigger nga na post. RadTech X has just exposed a patient for a chest radiography but incorrectly used technique factor for the examination. Instead of using technique factors for the chest, he had used a technique factor for the abdomen, which resulted in an overexposed image. Okay, so a very big deal, very big problem when it comes to screen film, but when it comes to computed and digital radiography, since we can adjust and there is an automatic scaling system, and then we can adjust the contrast and density of the image, so it is easily, or it can be easily corrected. Okay, so again, this is a histogram of the original image, and then an automatic scaling system, or the computer system of the CR and then DR system will automatically adjust the contrast and density of the images based on the examination that was required or that is set by the RadTech. Okay, so again, it's related to the exposure field recognition. So if ever this is your whole, again, if this is your whole or the whole of the imaging plate, okay, so even if the whole has been scanned, it should only be the collimated area that should be displayed on the monitor. So, for example, in this part, no, na not the whole of the imaging plate has been displayed. That means this is absent. Ano siya kaning gray nga part? This has been absent. So only the collimated part is present on the radiograph, on the monitor. Ano siya. So that means the computer has recognized the exposure field. Okay, so again, it is important now that the red tech or the operator should select the correct examination. If the examination is related to the skull, so this should be selected. If the examination is related to the upper extremity, then this should be selected. Or for the lower extremity, this should be selected. For the chest, for the abdomen, and then for the spine. So these are just for general. These are buttons that are for general examination. No? But when you try to click one of these, like for example, you would click the skull, then another set of commands will be displayed. Like for example, routine skull, skull AP and lateral, PNS examination for the temporomandibular joint, for the mandible itself, for the skull, okay, or for the facial bones, for Waters method. So a lot will be displayed. So for example, we would click the upper extremity. So if we click the upper extremity, then another set of commands will be displayed. No? For example, shoulder, humerus, elbow, forearm, the wrist, the hand. For the chest, chest AP, chest PA, chest lateral, chest and oblique. For the abdomen, it's most commonly the flat plate and then upright. For the spine, like for example, cervical spine, thoracic spine, lumbosacral na spine. For the lower extremity, for example, the pelvis, the femur, the knee, the leg, and then the foot. Included also is the ankle. Okay, so depends. So that's why there are a lot of commands that can be selected, and then the lookup tables are also different for the different types of examinations. Okay, so again, the main advantage of CR and DR system is the reduction of the repeat examination, especially when it comes to incorrect exposure techniques. Okay, so like for example, we would use a film screen, and then the factor or the exposure technique was very low, then that would result to a very bright image, which is of course unacceptable. Now, unacceptable when it comes to radiologists, because the radiologist would not arrive to a diagnostic na information. Okay, so diagnostic reading. Okay, so if we would also expose the anatomy to too much radiation, for example, in this one, the MAS has been doubled, so it would result to a very dark image. So similar lang gihapon with a very bright image, it would result to an unacceptable image. So not acceptable image because it is very dark. There is very little information that can be seen. Okay, so the anatomic parts, the anatomic area of interest is not well demonstrated because it is very dark or it is very light. Okay, so that's why an adequate amount of contrast density is necessary in order for the radiologist to arrive to a diagnostic information. Okay, so when it comes to digital and then the computed radiography ng mga systems, since we can adjust the contrast and density, there is an automatic adjustment of contrast and density. There's also manual na adjustment of brightness and contrast. Then even if the factors are very low, the factors are very high, we could still provide the radiologist with, diba? Just imagine very bright image and very dark image, but in the final image, they all appear as the same color. They would appear as the same density. Okay, so that is the advantage. So that means even if your factor is too much or too low, then repeat examination is not necessary. So again, that is because of the wide latitude of our digital imaging system. Now, the wider the latitude, the better. Okay, so that is one of the best, especially in digital imaging system. The wider the latitude, the better. When it comes to screen film, the narrow the latitude, then the better will be the contrast resolution. Okay, so almost opposite ang ilahang mga rationale. Okay, so that is the end of the discussion. So thank you for listening.